times. All right, we're going to move on to our agenda. At this time, we'll move back over to Andrew for our agency operations report.
Thank you. First up is an update on the legislative session, the 89th legislative session. So the budget bill, SB1, was actually voted out of the Senate yesterday afternoon, March 25th. I went back and looked at the budget bill from last session, and right now the legislature is about 2 weeks ahead of schedule from where they were in the previous session. So I found that kind of interesting. And I think just from an observation standpoint, kind of shows how much the two chambers, I think, are aligned in pushing the budget bill forward. The bill does include both of the 911 related exceptional items that we asked for. So that's the additional $5 million as a result of the Broadband Infrastructure Fund and the additional $380,000 for Permian Basin Regional Planning Commission. It is now headed across the Capitol Rotunda to the House side, where they will now go and do their deliberations and move the bill forward. And at some point, it'll go to conference, and we should have a final budget sometime probably in the next 30 to 40 days. So it moves forward, as they say. We do have a little bit of bad news. The TPN exceptional item, unfortunately, was not adopted in either the Senate or House version. We did have it originally adopted on the House side in subcommittee. Following internal deliberations at the committee at large, they decided to remove it. So that's a little unfortunate. However, we will still continue to explore some cost savings through a redesign and simplification of the network that would hopefully kind of offset some of the future contract costs that we were requesting additional money for. So long term, I still feel confident that we'll be able to provide the services that is expected through that program through the next biennium. So any questions on that before I move on? All right. Next up is our second quarter fiscal year 2025 performance measures. Our number of 911 calls received by PSAPs for this quarter was about 556,000, which puts us at 1.1 million for the fiscal year. So on target for our annual 2.8 number. Total number of poison calls processed statewide, we had about 92,000 calls, which puts us at 192,000 for the entire year. Average cost per calls for poison, you can see that, again, that number does fluctuate from quarter to quarter, mostly having to do with timing of when payments are processed from the RPCCs. So you can see our quarter performance is almost $38 per call, which is way above our annual target of $25.69. But then you look at our annual performance and we're actually below our target at $25.11. And again, that's just as the quarters come in, they kind of does like an up and down based off of when those payments are made. So it's more of a timing issue. And the last but not least, I do want to point out under our poison program on page 6, we did have on a non-key performance measure, we did have one outage that was reported that exceeded 2 hours for poison. It was a partial outage, so calls are still received. SPIs, specialists in poison information, just lost the ability of the electronic records management system to track cases. So they have to do it through a more paper-based process. So just want to kind of point that out that we did have a partial outage. But we were able to get that system back up and working. And again, the call still happened. It was just a little bit of a inconvenience for the call takers there for a bit. Any questions? All right, on to the fun stuff. So up next, we have our National Poison Prevention Week, which was last week, March 16th through the 22nd. We do have a proclamation signed by the governor. I'm going to go ahead and just read it into the record here because I think it really highlights the work that our spies do. So here we go. Accidental poisonings are a leading cause of death among adults, and more than 2 million poisonings are reported annually to regional poison control centers throughout the United States. Children under the age of 6 are disproportionately affected by toxic fumes, improperly stored chemicals and medicines, and contaminated foods. It is essential that Texans recognize the signs and symptoms of poisonings and learn the appropriate steps to take care for someone who has been poisoned. By taking simple precautions such as correctly storing harmful chemicals and medications, properly using child-resistant packaging, and learning about harmful substances, we can prevent accidental poisonings. The Texas Poison Control Network has provided Texans with 24-hour information and crucial referral services since 1993. Along with the 6 regional poison control centers, the dedicated professionals who answer calls from those experiencing a poisoning emergency share vital information, save lives, and create a safer future for the Lone Star State. Each year, the third week in March is set aside in order to raise awareness about poison prevention and to promote safer homes and businesses. At this time, I encourage all Texans to ensure the safe storage of potentially hazardous materials and to learn more about the resources available in case of accidental poisoning. Therefore, I, Greg Abbott, Governor of Texas, do hereby proclaim March 16th to the 22nd to be Poison Prevention Week. Signed, the Governor of Texas, Greg Abbott. All right, we'll just continue on with the proclamations here. So we also have, looking forward in April 13th through the 19th, we have Public Safety Telecommunicators Week, which again, I'm going to go ahead and read it here. We actually have the proclamations up here if anyone looks at them after here. Public safety telecommunicators are unseen first responders who help save lives every day during emergencies. These dispatchers, 911 operators, and communication specialists connect Texans with police officers, firefighters, and medical personnel while reassuring distressed callers. Their calm, disciplined demeanor strengthen those in need, and their composure and communication skills pave the way for the best outcomes in perilous situations. The men and women who serve as public safety telecommunicators must adapt to an evolving emergency response field, and they do so while maintaining the highest ethical and professional standards. Throughout the Lone Star State, more than 4,000 professionals answer the call for those in need, and I commend them for their service. Each year, a week in April is set aside in order to raise awareness about public safety telecommunicators and to honor their contributions. Our state is more secure because of their dedication to their neighbors. At this time, I encourage all Texans to recognize the vital role that public safety telecommunicators play in our lives and to express their appreciation for these compassionate professionals. Their expertise and strength in times of crisis ensure that our communities receive assistance when they need it most. Therefore, I, Greg Abbott, Governor of Texas, do hereby proclaim April 13th through the 19th to be Public Safety Telecommunicators Week. Signed, Governor of Texas, Greg Abbott. And I think that is all I have.
All right. Well, remember, that's actually the 13th through the 19th. And so not all of us get to come across those. Chip sees them. You see those folks a lot. But I hope if you do, keep that in mind and be sure to pass along your appreciation that what they deal with, there's really no resolution that can thank them for that service. So that being said, we will move on to our next agenda item. Thank you, Andrew. Lorraine, you're up. Just as a note, in your packet, they don't have the cover sheet there, but it's in the little deal they set out for you. So we'll have Lorraine give us our revised prepaid wireless 911 fee distribution percentages.
Good morning, Commissioners. My name is Lorraine Meek, the Chief Financial Officer for CSEC. And if you turn to your commission notebook, on November 30th, 2024, the demographer released a report revising the population estimates. And so with that, CSEC has 90 days to provide updated distribution percentages to the regional planning commissions, RPCs, and the emergency communication districts in accordance with Rule 252.6. CSEC reached out to North Central Texas, ECD, along with pulling their information from their specific website for the demographer report for the Dallas-Fort Worth area. And that information was utilized in determining the percentages for that area itself. All of the data entered into the workbook and distribution to the ECDs and RPCs. And that information was distributed to the ECDs and RPCs for any feedback. The communications we received back, there was a few, but it did not affect the percentages that were proposed. CSEC staff recommends the adoption of the proposed proportional distribution percentages. I am here to answer any questions.
Any questions for Lorraine? If not, then we would entertain a motion to approve.
Mays, make a motion to accept her recommendation.
All right. Lucille made a motion. Is there a second?
Van Steenberg seconds.
There's a motion and a second. All those in favor say aye.
Aye.
Any opposed say no. The ayes have it. And
Fabulous.
that is taken care of. Lorraine is going to stay with us, though, and now she's going to provide our appropriation year 2025 financial update.
Yes. If you please turn 3 pages over, and we will go over the financial status for 2025. We are now 50% through the AY, or appropriation year, and not a lot has changed since the last report. A majority of the information that's changed is what we've expended and accrued and the revenues that have actually come in through the for the last couple of months and our estimated fund balances for the end of the year. So if you follow along, starting with the expenditures, we are sitting at $80 million, 80.6. Of that, the General Appropriation Act provided us $64 million, and in addition, we UB'd, we rolled forward from the prior year $15 million for 911 grants and $788,000 for poison grants. Again, the amount expended and accrued deals with our strategic plans for the grantees, the Poison Center contracts, and administrative contracts and other payables. So, of the available balance, the is 5.9 of it is of the appropriation. So we've appropriated all but 5.9% of it. And of that, 91% relates to the 911 network operations equipment replacement, which you'll hear a little more about later. In the revenue section, I'm going to speak to the total revenue column. We have a little over $736,000 in prepaid revenue, almost 11.7 in regular wireless revenue. And landline is a little over $1.7 million for a total of $14 million. And then our equalization surcharge is just under $10 million, bringing a total just short of $24 million. Now, if we apply the 50% of the appropriation, that's GRD, to how much we've received to date, we are underfunded by $6.9 million, in which we use the fund balance. But of that, about $600,000 of our appropriation has not been spoken for yet. So you can take that into consideration as well. As we go across the revenues, in January, the Comptroller's Office released their new biennial revenue estimates, and CSEC reflects an additional estimate of $312,000 for equalization surcharge. So previously, we were under 50 million, and now we're just a little over 50 million as our revenue estimates for the agency. With our revenues at 24 million, and halfway through the year, we should have 25 million. We're just under received by 1.1 million, but it should true up in the August. It's a timing difference for a lot of the variants. So no cause for concern at this point. Our fund balances, we look healthy with all the legislative work that we've done and receiving additional funds. As it shows there, we're expecting over $23 million of Prop 8 funds to eventually move into our 50-50 fund balance, which brings it up to over $50 million estimated fund balance at that time. Now, this is informational, but I am here to answer any questions.
Any questions for Lorraine? Other than that part about, oh, don't worry, it'll come. It'll be here in August.
I can show you historical information that will show that too.
I know. All right. If there's no questions for Lorraine, we'll move on. Thank you, Lorraine.
Yes, sir.
The next item up is our Next Generation 911 Service Fund, our federal grant program update from NOAA.
Good morning, Commissioners. I am Noah Gillum, the Director of Contracting and Purchasing, and I'll be providing the update for the federal grant for SB 8. First, I would like to point out, under the status, you'll see that the expenditure status as of January 22nd, 2024, obviously that is not correct. Let the record show that it's March 19th, 2025, so a week ago. I'm happy to report that our expenditures still match the time elapsed, so we're at 66% of the time elapsed for the program. We also are at 66% expended. We're currently sitting at $99 million out of the $150 that has been reimbursed, And outside of this table, the only thing that I want to point out is that we did have a few deobligations from 3 districts, City of Mesquite, Medina County, and Wichita-Wilbarger. And those you'll see reflected under unallocated at the end of that table of $520,000. You should have a staff report later on from programs to reallocate those funds across the RPC program, and that is per the commission meeting action last May of 2024 of any unexpended funds after December 31st being sent back into the state R911 program for redistribution. Moving on, for the obligation exercise for the deadline of 12/31/2024, we had a few folks who weren't able to meet that deadline, so we have been trying to get them in line with a new obligation date per their particular situations. So I'm happy to report that the city of Aransas Pass, actually, we did execute their amendment yesterday. So now that only leaves the city of Plano, and they do believe that they had their city council regarding that item on Monday. So I anticipate that coming in fairly shortly. Other than that, the information presented in the staff report is for informational purposes only, but I am happy to answer any questions that you may have.
Any questions for Noah?
I don't have any questions. I just want to thank you, Noah, for assisting our cities in getting this done. Many of these cities are small and they just don't have the capacity to do this. So appreciate you doing what you've done to help them. Thank you.
It's my pleasure. Thank you so much.
Some of those cities have a real good mayor, though, and that kind of helps move things along. All right, Noah, thank you. All right, at this time, we'll move on to item number 5, which is the Montgomery County Hospital District EMD program in a local contract consideration of a material change in Kimber. If you'll come forward.
Okay. My name is Kimber Snoddy. I am CSEC's contract manager, and I am here to request approval for an increase in funding for our contract for emergency medical dispatch services. For some background, this contract was entered into in September of 2015 under Health and Safety Code 771. We are contracted with Montgomery County Hospital District, who serves to provide pre-arrival instructions that may be accessed by selected PSAPs who do not have the adequate resources themselves. Currently, we pay a little more than $53,000 annually to the district. We have identified a need to add 28 PSAPs to the program, and due to increasing the program size, staff has deemed it necessary to increase the annual funding for the program from $53,000 to $75,000 effective immediately. And just to note, because that increase is greater than 10%, under Texas Government Code 2155.088, we're required to get our commission's approval because it's a material change of the contract. So with that being said, staff recommends that the commission vote to approve the increase in annual funding for the emergency medical dispatch program contract. Thank you.
I do have a question, James. On,
You bet.
I guess on the total amount, you got 28 new PSAPs that you want to bring on board,
Yes,
and you changed from 53,000 to 75,000.
correct.
How can you do 28 for that small of a number increase?
I'm gonna bring Heather up here.
I mean, it's good that you can do that. It's just amazing to me.
For the record, my name is Heather Barnes, Director of Programs. This is what you can consider seed money. We provide money up front for the contract. The participating regional planning commissions also pay on a cost per call basis. So Montgomery County will also, based on the cost, the estimates of the calls, Montgomery County would also receive from the regional planning commissions $125,000 annually for the additional 28 PSAPs that are added. So it would be about $22,000 from us, but $125,000 from the regional planning commissions that they're able to have fit into their current budgets.
Makes a lot more sense. It's kind of like that match, right?
Correct.
Yeah, okay, wonderful.
Just as a note, I'm very familiar with the program. It's gone on for a while, and it's amazingly helpful to small communities that don't have the ability to have EMD.
As a note, I noticed whenever they said add 28 PSAPs, Lorraine looked at me like she was waiting for me to go cuckoo bird. I didn't. See there? As a little background, Commissioner, so this program came about in the early 2000s at some point, and at that point, it wasn't our program. It was the University of Texas Medical Branch in Galveston. They just took $50,000 from us from equalization surcharge to fund the program. In 2015, that program did get moved over to us as the administrator from UTMB. And so that's been, oh God, well, that's been 10 years, hasn't it? In talking with staff this morning, I think we get back information on calls and things like that from them, number of calls and all those sorts of things, and the types of calls. In that original bill in 2015, one of the things that we were tasked with is to evaluate the program on a regular basis and also to provide a biennial report to the legislature about it. I don't think we've ever done that, to my knowledge. And I do think the program is good as well, Lucille. I think it's an excellent program. There may be some things happening at the federal level that are going to require wider deployment of these types of services. So one thing I would like for us to do is at a future commission meeting to have maybe a little bit more in-depth report on the program. Let's put together some information to submit back in a legislative packet. It may very well be that we need to expand that program and ask for some additional funding outside of our normal funding venues in the future. And so I think that would be good, both for familiarity amongst the commission. I mean, you see the program because you're down there, but most people are not really aware of that. So I think it would be good to make us aware. Again, like Lucille said, I mean, I think there was one person that had to be on the phone for over an hour giving CPR instructions. I mean, and I think one of the things staff has done is looked at, you know, wider usage of that. So I think that would all be very helpful if that would be okay.
At this time, Mays, I'd like to make a recommendation to approve your recommendation. A motion to approve, sorry.
Sorry, you're a second.
There's a motion and a second. All those in favor say aye.
Aye.
Any opposed say no. It is unanimous.
Thank you.
All right, we're going to move on to our 911 service program. Jessica, you have Regional Planning Commission strategic plan amendments and adjustments to the federal funding allocations.
Good morning, Commissioners. For the record, my name is Jessica McLemore, 911 Program Manager. Please turn to page 24 for the federal funding allocation adjustments. At the July 2022 open meeting, the Commission allocated $21.5 million in the NextGen 911 core services and the NextGen 911 equipment to the RPCs. At the July 2023 open meeting, the Commission allocated an additional $4 million, and in September 23, the Commission replaced federal funding with general revenue for 3 RPCs due to procurement issues. An additional $3.3 million was allocated last May. Since then, projects have been completed for 4 RPCs, and it's necessary to reduce their allocations to allow for timely expenditures of funds. In total, the proposal includes reducing allocations for 4 RPCs and allocating additional federal funding for 14 RPCs. Also included in the proposed allocations is $520,311 in funds returned to the agency from contracts with the City of Mesquite, Medina County ECD, and Wichita-Wilbarger ECD. The accompanying chart titled Next Generation Allocations includes the total allocation amounts to date and the proposed adjustment amounts for this meeting. Staff recommends that the Commission approve the allocations from the NextGen 911 Fund, account 0195, to be used specifically for Next Generation core services as outlined in the accompanying chart to the staff report, and authorize its Executive Director to revise and execute with each of the affected RPCs the recipient 911 cost summary. And I'm available for any questions.
Any questions for Jessica? If not, I would entertain a motion to approve the strategic plan amendments?
Mitchell so moved.
There's a motion. Is there a second?
May 2nd.
Motion and a second. All those in favor say aye.
Aye.
Any opposed say no. The ayes have it. All right, Jessica, you're up again with the Regional Planning Commission strategic plan amendments on request for additional funding.
If you would, please turn to page 27 for the request for additional funding. In anticipation of procurements for network router replacements in the next fiscal year, staff have initiated 4 requests to amend approved strategic plans for FY25 with requests for general revenue and include Alamo area in the amount of $167,773, Coastal Bend in the amount of $365,374, Middle Rio in the amount of $203,654, and South Plains in the amount of $176,122. Staff recommends that the Commission approve the strategic plan amendment request for additional funding as presented in the staff report, and authorize its executive director to revise and execute with each of the affected RPCs the recipient 911 cost summary. I'm happy to answer any questions.
Any questions for Jessica? I'm starting to question now, do I need to replace my router? I didn't even know about that, but there you go. All right. Any questions for Jessica? If not, would entertain a motion to approve these strategic plan amendments.
Van Steenberg will make the motion.
There's a motion. Is there a second?
Gross seconds.
There's a motion and a second. All those in favor say aye.
Aye.
Any opposed say no. The ayes have it. All right, Jessica, trifecta today. Regional Planning Commission strategic plan amendments request to amend the approved strategic plans to acknowledge the transfer of Edwards County.
Please turn to page 29 for the Edwards County amendments. Edwards County joined the Middle Rio Grande Development Council in 1970 following the establishment of the Regional Planning Commission. For more than a decade, there's been discussion between the leadership of Edwards County, Middle Rio Grande, and Concho Valley Council of Governments regarding Edwards County transferring to Concho Valley. Edwards County submitted a request and was granted approval by the Office of the Governor in February. Commission staff is working with the Concho Valley and Middle Rio Grande staff to migrate the PSAP in Edwards County to Concho Valley's 911 network. Most costs have been identified and will have minimal impact to Concho Valley's current budget. Commission staff will continue to provide technical and budgetary assistance as necessary during the transition. Staff recommends that the Commission approve the addition of Edwards County's activities to Concho Valley Council of Governments FY25 strategic plan and approve the removal of Edwards County's activities from Middle Rio Grande Development Council's FY25 strategic plan. And I'm available for any questions.
Any questions on this one for Jessica? I would say Kathy Scrow makes a motion, but I guess y'all probably catch me on that. Kenny's over there looking at me pretty hard. If there's no questions, would entertain a motion to approve these strategic plan amendments.
Muscat motion to approve.
There's a motion. Is there a second?
Mitchell second.
There's a motion and a second. All those in favor say aye.
Aye.
Any opposed say no. The ayes have it. All right, we're on to number 4, which is our final RPC compliance assessments for fiscal year 2024. Madison. Now, Madison, is this your first time
Yes.
to provide a report to the commission?
Yes.
Well, welcome. Congratulations.
Thank you.
All right, don't be nervous.
Okay. Good morning, Commissioners. For the record, my name is Madison Powell, 911 Program Assistant. Please turn to page 31 in your notebooks for the FY24 compliance assessments. Each year, the Commission concludes its monitoring of the regional planning commissions with an end-of-year compliance assessment. Monitoring activity provides Commission staff with information and data necessary to best assist the RPCs in implementing and strengthening the 911 system in Texas. With the conclusion of the annual monitoring activities, staff can report the following information. Of the 20 RPCs, 7 were initially classified as low risk, 7 as moderate risk, and 6 as high risk. All RPCs were able to demonstrate improvement and lower their final assessment scores. Individual risk assessment scores are available on page 32 of your notebooks. Commission staff recommends the Commission accept and approve the final FY 2024 compliance risk assessments for each RPC as provided in this report,
and I'm available for any questions.
You have a question?
No, no question. I was just getting ready.
Oh, well, look at you go, Chip. All right. Well, at this time, I would entertain a motion for us to approve the RPC final compliance assessments for fiscal year 2024 with the addendum that Madison did a great job on her first time up.
Thank you.
That was going to be part of my motion.
Oh my God, I'm sorry, Chip.
Thank you very much, Madison. Van Steenberg will make a motion to approve.
All right, there's a motion. Is there a second?
Sorry, your second.
There's a motion and a second. All those in favor say aye.
Aye.
Any opposed say no. The ayes have it.
Thank you.
All right, Miss Heather, come on down. Program policy statement, or as we refer to them, our beloved PPSs, number 12.
Good morning, Commissioners. For the record, my name is Heather Barnes, Director of Programs. If you would, please turn to page 33 for the revision of PPS 12. Program policy statement 12 outlines, let me turn my bracelet and it's rattling. Outlines the requirements for RPCs to add a PSAP, consolidate or close a PSAP, and add a workstation position. The proposed changes to the PPS increase the minimum number of 911 calls requirements for an RPC to request to add a primary or secondary PSAP or to add a workstation. They updates the language to reflect only 911 calls are to be considered, clarifies language related to the purchase of 911 equipment, and clarifies language regarding workstations and consolidated PSAPs. The proposed changes will not retroactively impact workstation counts and will only impact future requests. In accordance with PPS 000, because we have a PPS on how to do PPS, staff collaborated with TARC and the CSEC RPC 911 Program Operations Advisory Group to review PPS 12. The parties agree on the changes presented. Red lines begin on page 40, and the current Exhibit B is on page 48, and the proposed Exhibit B is on page 49. Commission staff recommends that the Commission vote to adopt revised PPS 12, PSAP adds, moves, changes, consolidations, and closures, adding a 911 workstation. And I'm happy to answer any questions.
Any questions for Heather?
I've got one. Heather, if there were some odd situation, like, unusual, where a cog was very close to that number of calls but didn't meet it, but could show other factors to justify it, could they bring that to the staff as a request?
As with any PPS, we would consider other factors that could be considered to be brought forward to the Commission for approval.
Okay, thank you.
Any other questions for Heather? There being none, I would entertain a motion to approve the the revision of PPS number 12.
Must get motion to approve.
There's a motion. Is there a second?
It's gross seconds.
There's a motion and a second. All those in favor say aye.
Aye.
Any opposed say no. The ayes have it. All right. We'll move on. Thank you, Heather. We'll move on to our poison control update. And first up, we have Dr. Baker. Welcome.
Good morning, Commissioners. For the record, David Baker, Central Texas Poison Center. In your packet, you have a couple of slides. I give this to you guys every year to see how we're doing. I just realized that the scale on the first slide is way too big. But anyway, the point being is that we're on track for our normal progression of growth of human exposure calls, basically. And we've kind of stabilized out the proportion of those calls that are from hospitals and needing our care, basically. So roughly about a third of our calls come from hospitals needing help with managing their patients. The other 2/3 now are normal household type things. And as you can see, the slope going up there for all the years that, prior to COVID, that we were more and more hospitals were requiring our services. Then the last point was the key point selection. If you look at the bottom one there where it says 9.23 growth since 2018, that's on track for the 1.5% per year, with that blip being the COVID years, of course. So that's the presentation. I do want to add something that my CSEC staff people there are not prepared for. I want to say that I'm tough on them. CSEC did a great job when COVID came and made a transition and made us able to work from home. We've had some problems with that, and you're going to hear some things later. And one of the big problems we're just facing now. But I do want to thank them significantly for all the effort and all the time they put in. I know Jim has spent, for many times, 60, 70, 80 hours on the phones with us through these problems, but he's made it where we were able to keep people working from home, and we never lost any employees because of COVID. So I want to thank the CSEC staff. Thank you.
All right. Thank you, Dr. Baker. All right. At this time, we'll bring up Grace to talk about the Texas Poison Control Network migration update and consideration of possible material change to the contract for TPCN 2.0 environment licenses. My God.
I didn't come up with the
This
title.
is almost worse than making us take that YouTube class.
Well, good morning, Commissioners. My name is Grace Ruey. I'm the Director of IT. I'm here to update you on the Texas Poison Control Network and inform you of migration efforts being made by the agency. The Texas Poison Control Network is currently built upon a cloud instance hosted through VMware. VMware was recently acquired by a company called Broadcom, and with this acquisition came some changes. One of those changes was removing the current cloud instance the Texas Poison Control Network is built on. And we received a notification on January 30th, 2025 that CSEC's cloud instance would be shut down by April 30th, 2025. All workloads and data would be deleted and irrecoverable, and it was suggested customers migrate to a different solution as soon as possible. CSEC staff reached out to Broadcom for clarification and understanding of how Broadcom could help with this migration. Broadcom stated they would not be helping customers with migration efforts other than high-level technical questions. CSEC staff began researching migration options. It seemed the easiest option was to migrate the commercial instance of the same product, which is VMC on AWS GovCloud, so VMC on AWS Commercial. CSEC engaged their current reseller, Worldwide Technology, or WWT, to understand the logistics of the migration and the implication it would have on their current agreements. CSEC's in the process of getting more information on how this migration will work both technically and contractually with help from Broadcom, Amazon Web Services, or AWS, and WWT. CSEC is exploring alternatives to stay in a GovCloud instance and move away from VDIs in the long term to create a more reliable and secure network. CSEC has informed the Regional Poison Control Center's managing directors of this migration and is in the process of dispersing contingency plans that will allow for calls to continue to flow if migration efforts are delayed or if issues are to arise. Our goal is to have minimal or no impact on the end users and the callers of the Poison Control Network. We hope to begin our migration efforts this week or next, with testing to happen prior to cutting over all of our users to the new cloud instance. This agenda item originally stated we may increase current contracts. However, through conversations with our vendors, it was determined that any migration effort would be considered new service and would not meet the thresholds where commission action was necessary. I'm happy to answer any questions.
That was an excellent report, Grace. I'm not sure if I understand all of it. But essentially, we're migrating over. It's about to happen fast. You're on your own. That was the deal there, but y'all have got it handled, is what you're...
We're going from, where are we going to?
Right now, we're still making that decision. It seems like the best path forward maybe go to AWS Commercial Cloud, but we are exploring options of staying within AWS GovCloud. So
There's not a whole lot of options, right?
no, there is not, and there's not a lot of time. So this has been a fun challenge for us to figure out and work quickly. And I thank Dr. Baker for the nice words he said about CSEC, and our goal is to retain their ability to work remotely, as well as keep the calls flowing and make sure their tools are accessible to them. So,
And I would just like to add, as Grace said, this information that was provided to us by our resellers caught the agency completely off guard. We were not expecting this. There was no forward notification. We were essentially given a 90-day end of life notification of this happening, and essentially we're told, figure out how you're going to migrate it itself. So we have been working over the last 2 months to come up with a migration plan. I can tell the Poison Control centers that this is the number one priority of the agency. This is something that we deliberate and talk about almost all day, every day. So it is something that we're hyper focused on and has complete attention of the agency to ensure that there's no disruption of services, that we maintain services, and that we're able to successfully transition this to a new cloud instance.
Is there a
Was there any reason that they gave us that?
It's mostly because of the new acquisition that Broadcom made of VMware. With it, they just had different changes, and they have eliminated not only this service, but many other services. They're also just restructuring. Broadcom's a multi-billion-dollar business, so they're kind of realigning their efforts and kind of picking and choosing what products they're going to offer. So.
You have
the drawbacks from finding somebody else? Outside of this, there's maybe like 2 out there.
Yeah, we are looking at other vendors, and we've kind of done our due diligence with the procurement team. We're still working on our final decision, and we do hope to kind of, in a long-term project where it's not a 60-day window, kind of plan this properly and get something that's a little bit more stable, less reliant on third-party vendors who can make changes at the drop of a hat and turn our world upside down. So,
yeah.
Do you have any idea how many other state agencies or maybe even federal agencies were affected by this? And if so, could we partner with them in a bigger contract or a bigger package?
There are options to work with DIR. I haven't heard from Broadcom about any state agencies facing this problem, but I know that several federal agencies are in the same position that we are. And they have even larger networks than we do. So we are going to look at working with DIR for more security and consolidation for that future project.
Thank you.
So in the original staff report, you had staff recommends the commission vote to approve any potential amendment, if necessary, which may increase the existing contract by over 10% to ensure compliance with procurement and or purchasing requirements per government code, blah, blah, blah. Sorry, Kenny, blah, 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 but you've got it written down here. So you're going to have to contract with somebody else. And I know you're saying the cost probably isn't going to be an issue there, but do you have all the authority you need today to do whatever you need to do between now and April 30th?
Yes. When we had originally drafted up the staff report, and due to open meetings and having to post the agenda, we wanted to ensure we had enough flexibility in having items in the agenda to vote on if we needed it. As Grace said, this is a very fluid situation, but based off of the developments that we had earlier this week, we don't believe that we'll actually hit any of the thresholds to do what we're looking to do.
And many of the contracts we have were signed several years ago and had optional extensions. So those vehicles through DIR are no longer active contracts. So if we procured anything, it would be from new contracts, and therefore wouldn't be a material change to the current contracts we have.
Are we thinking this 10% is enough?
So we're saying we don't actually need to increase the contract at all. So we've essentially changed it to an informational update versus actual commission action at this time.
Okay.
And that's because it would be a new contract.
It'd be a new contract, and I think the first part would be looking at just contracting through the end of this fiscal year. So we're only looking at five months of costs, which wouldn't actually hit any of the thresholds, and then essentially looking at more of a final solution on the fiscal year calendar.
Okay, thank you.
All right. Well, I was ready to give you whatever you wanted just to get it fixed by April 30th. That's like when your plumber gets to your house, starts telling you what it's going to cost, and you're like, I need air conditioning. I need water, running water. All right. Well, in that case, if that is informational, thank you, Grace. You did a good job. Thank you. And by the way, have you got everybody lined out on their cybersecurity
I believe
training.
so. We have, just one hanging out there, but everybody else has signed and returned their attestation to me. So appreciate y'all taking that cybersecurity training. It's important to keep our cyber resources safe. So it starts with the person.
Gotcha. All right. Well, if that is the case, we don't have any other business before the commission today. So at this time, I would entertain a motion to adjourn.
Sorry, we'll move to.
Vince Steenberg seconds.
There's a second. All those in favor?
Aye.
All right. It's 10:49 and we are now adjourned. Thank y'all.